Group therapy involves one or more psychologists who lead a group of roughly 5 to 15 patients. This type of therapy is widely available at a variety of locations, including private therapeutic practices, hospitals, mental health clinics, and community centers. Typically, group therapy sessions will meet for an hour or two each week. Many groups are designed to solve a specific problem such as depression, obesity, panic disorder, social anxiety, chronic pain, or even abuse. For our video presentation, we are focusing more on anxiety disorder.
Hi, today I will talk about the process of group therapy. First, it will allow each group member to rewrite the organic pattern that they go through when trying to build and maintain the relationship. We will focus on interpersonal process. Group is less on there and then, such as the relationship with your partner or your daily life experience, and more and then here and now, like the relation you are having to your fellow group members, or learning about the impact that your way of speaking is having on your fellow group members. That is what makes the process group experience feel so unique. Secondly, the process in a group therapy is heighten the awareness of psychological defense that sabotage the ability to meet a fundamental human, which is connection. One way to view group therapy is as a group of people coming together with a mutual interest in learning to care for each other as freely as possible. Unfortunately, most people have been hurt in their connection in important relationships, which lead them to unconsciously protect themselves, aka to develop defense. In a group, insight into defense led to deeper opportunity to connect than ever before. Lastly, being a social laboratory is also the process of group therapy. It gives people a chance to experiment with new behavior that many normally feel uncomfortable trying out with the people currently in their life. You tend to be spontaneous and want to work on controlling impulse better? Maybe you can spend a whole group not speaking. You tend to overuse an aggressive communication style. Maybe you can spend a whole group only saying kind and empathetic things to everyone. There are limitless ways to experiment with new interpersonal patterns in the group setting. That is all from me. Thank you. I will pass it to my friend Ainu.
Next, the advantages of utilizing group therapy. Firstly, group therapy provides a change for people to look in the mirror. When a person is trapped in this cycle of negativity, it can be difficult to see that what they are deciding to do is wrong from their perspective. By seeing others with similar thinking patterns, it can become possible to address a personal negative cycle by seeing similar cycles in others. Secondly, talking to people makes it easier to talk with family. Group therapy sessions often require talking about difficult issues. The practice and safety of sharing in this environment can encourage people to talk with their family or friends about their struggles. In turn, this can lead to a larger network of supporters who can keep that person on the right track. Lastly, there is often less judgment in a group therapy session. Within a group therapy session, there is more sympathy and less judgment because there is a greater understanding of the thinking cycles and behavioral choices. Next is the disadvantages of utilizing group therapy. Firstly, there can be personality conflict. In a one-on-one therapy session, a personality conflict between a therapist and patient can be easily controlled. In a group therapy session, every additional member of the group increases the risk of a conflict occurring. Next is, it can make people uncomfortable. Many group therapy sessions involve a personal discussion that can become very intense. Some therapists may use role-playing scenarios or encourage group members to share very graphic details of the issue at hand.
Now, I will continue with the application of group therapy in terms of treating social anxiety disorder. So, how group therapy works for social anxiety? The purpose of group therapy for social anxiety disorder is to help people form new relational patterns and response to situations that increase the anxiety in social situations. Here are the ways on how therapists or counselors overcome anxiety disorder among their patients while in group therapy. Firstly, during group session, counselor will frequently ask leading questions to encourage their patient. It will help the person going through the discussion, connection, and assist them in a group social contact. The patient may also volunteer themselves to speak up, or the therapist may ask someone to share their opinion. Through discussion, we can see that the conversations are always fluid and organic. Other than that, some counselor will assist patients in rehearsing some scenarios in order to get through their anxiety. It also refers as exposure therapy, which the patients among the group will be exposed to a real-life scenario over time as the persons start to learn to control the anxiety symptoms. Sometimes, a member of the group may be asked to work on specific scenario and other person to prepare for an upcoming scenario. such as a business meeting or a first date situation. As we can see, they always have an interaction in a group therapy that might encourage the patients to overcome their social anxiety.
Assalamualaikum, I am Putri. So let's continue with the third application, which is counselor will help each patient in the group to set problem-specific goals and check in to see their progress. This progress is usually checked on a monthly basis. Setting goals is critical for people who want to improve their life. Its focus is to enhance the overall quality of life while minimizing the negative effect of mental and physical illness. Setting goals make it easier to stay accountable for the things you want to accomplish. Apart from that, setting goals is even more important for people who are in counselling or therapy. Failure is frequently caused by a lack of understanding of how to properly set up our goals. Setting goals can help you not only with your mental health, but also with your depression. When it comes to overcoming obstacles and achieving goals in life, goal setting serves as a roadmap. This can lead the patients to make positive changes to improve their anxiety. Lastly, counsellor will usually check in and keep track of patients' life outside the group to assess their progress after receiving the treatment. People usually notice gradual changes in social interactions or confidence after a month or two. People gain confidence in their daily life as a result of social practice in a group setting, as group work allows people to practice challenging social interactions in a safe environment. Other than that, it is important to ensure that the plan of treatment is being followed and how it helps to improve the person's life. It is possible to tell if the therapy is working by tracking their progress. It also allows for a more objective assessment of progress, as well as the identification of negative changes when they occur. This enables the counsellor and the patient in a group therapy to address these changes immediately and maintain the progress. You will be able to see the signs that the patient has successfully completed therapy and when their treatment has come to an end by tracking the patient's growth over the time.
Anxiety can be treated with group therapy as it improves our social skill. As we all know, it is hard to connect with other people when we have negative emotion or mental discomfort. As a result, they will experience frustration or sadness. With group therapy, they will be able to express their feelings and be encouraged to communicate with other people. Group therapy is designed for a specific problem. Therefore, by doing group therapy that generally focus on improving social skills, it will help them to boost their confidence to express their feeling and communicate with other people. This confidence help them to cope with their surrounding better. Besides that, they could make new friends along the way. Next, you get to reduce the feeling of loneliness. When people with anxiety watch other normal people living their perfect life as if they don't have problems, any mental or emotional discomfort, it will kind of make them feel lonely as they think they are the only one that are struggling with themselves. Group therapy help people that have the same problem to cope with their loneliness by sharing their problem and anything which cause their emotion and mental discomfort to those who are in the same shoes as them. Knowing other people have the same problem as them, it will make them feel like they have someone who understands them well.
Now let's move on to our next point, which is the group therapy can also help to build a support system for the patient. This is because the group therapy is not only between the psychiatrist and the patient, but it also involves all the members in the group that have the same problems and same difficulties as the patient. During the therapy, all the members of the group are encouraged to give their feedback, support, and also discuss together of the solution to the problem. This process will help to grow the connection between the members and they will feel like they always have someone that will support and encourage them. Lastly, the relevance of group therapy in treating anxiety disorder is the patient will get to know themselves. This is because people with anxiety disorder tend to not open up about themselves. But through group therapy, they will get a chance to discuss about the fear, challenge, and emotions to someone that expert and someone that have the same situation with them. This process will help them to find out how others perceive them and discover what the cause of their anxiety. It also will help them to discover more information about their anxiety disorder. Therefore, the group therapy will help them to solve the problem, overcome the fear, and also help them to learn on how to manage their emotions and their mental discomfort. According to the new network meta-analysis study from the Department of Psychiatry of Oxford University, the group therapy is still used to treat the anxiety disorder because it has been proven to be effective, especially for the young people. This study shows that the group cognitive behavioral therapy could be the choice for psychotherapy for children and also adolescents.